We're for sharing innovative treatments and preventing disease before it ever develops. Learn how our team is working to better care for you on this edition of UVA Health System Radio. Here's Melanie Cole.
Robotic surgery has increasingly become a minimally invasive option for adults in recent years, but what about for children? My guest is Dr. Sean Corbett. He's a fellowship-trained pediatric urologist whose specialists include caring for a wide range of kidney conditions in children at UVA Children's Hospital. Welcome to the show, Dr. Corbett. Tell us a little bit about robotic surgery and what are some of the goals of using it?
Well, thanks, Melanie, and thanks for this opportunity. Well, robotic surgery is it's one of the tools in our toolbox, which has expanded our ability to treat patients of all ages in a minimally invasive approach. And the robot just facilitates what we used to or traditionally did with laparoscopic surgery, where it allows much greater range of movement, enhanced visibility with 10 times magnification, improved precision, high definition 3D visualization. So it really has facilitated our ability to do a lot of things that we've traditionally done laparoscopically, but now are able to do robotically in a much easier fashion.
Dr. Corbett, give us an example of some of the conditions that you're using robotic surgery to treat.
Sure. Well, there are a number of conditions, and really the envelope continues to be pushed by centers with the greatest amount of experience. Here at UVA, some of the conditions that we've treated, or certainly most commonly, are what's known as hydronephrosis, or children with ureteropelvic junction obstructions. And we've treated them with robotic-assisted laparoscopic pyeloplasties, but also kidney reflux, duplicated kidney systems, ureteroseals, bladder surgery where we need to augment the bladder in the cases of children with spina bifida. So really a whole host of procedures across the board with regard to pediatric urologic conditions.
Now, what children might this be an option for? Are there some that really are not candidates for robotic surgery?
I think that's a very good question, Melanie. I think I think in the appropriate hands, the robot really facilitates robotic surgery across the board. Certainly, in my experience, for the really small child or infant, rather, and we're talking less than 5 kilograms, it becomes certainly a much greater challenge to perform a procedure on that smaller infant child laparoscopically or robotically. But aside from the size, there aren't a lot of children that aren't good candidates for robotic surgery, unless they've had multiple previous abdominal surgeries. That might be the only other indication where robotic surgery is not the best first option.
So, Dr. Corbett, let's talk a little bit about some specific conditions. Hernia repair. This is quite common in children, boys especially. Tell us a little bit about what's involved in hernia repair. How would a parent spot a hernia in their child?
Well, a hernia in a small child or an infant, it's a very different disease condition than it might be in an adult. A hernia in a child is something that's known as congenital abnormality, and the connection between the abdominal cavity and the scrotum remains open, which allows either fluid to communicate or even intestine to herniate through. And that is a surgical condition that typically, or certainly traditionally, has been treated with an open incision in the groin in order to repair the defect. But more frequently, we are approaching this from a minimally invasive standpoint, and a laparoscopic approach or a laparoscopic percutaneous approach is what I commonly employ in the infants that I work with. The robot, because the procedure is so quick, doesn't have a specific role as of yet in the treatment of this condition.
And what can parents expect after a hernia? Is there a long recovery period, or are the children pretty much great afterward?
It's somewhat dependent on the age of the child, but most of the infants and children are back to their normal routine really within a day or two. It's the great thing about, the minimally invasive approach especially, but also working with children, infants, is that they tend to recover very quickly, and even more so with the minimally invasive approach.
Now, so with the robotic surgery, discuss one of the treatments that you use it directly for on children and what you've seen as the outcome.
Sure. I mean, the most common disease condition that I would treat with the use of the robot is what's called performing a pyeloplasty. So we do a robotic-assisted laparoscopic approach, and essentially that's a condition where the urine draining from the kidney is blocked at the junction between the kidney, essentially, and what's called the ureter tube, which is the draining tube from the kidney. So there's a congenital abnormality that results in a blockage there. And so with the robot, we're able to go in, cut out that defect or the abnormal portion, and then sew the two good portions back together. The children do really well with this. The procedure itself takes about 2 hours, a little bit longer just in terms of the time that they spend in the operating room that's entailed to put them to sleep, to wake them up, to do the imaging studies at the beginning of the procedure. But the overall procedure is about 2 hours. The children usually stay just overnight in the hospital, so almost all of them will go home by the next morning or certainly early afternoon. And they recover very quickly. I mean, it's fantastic to see the difference between the way children recovered when I started this, and we were doing all of these procedures through open flank incisions, so a generous incision through the flank underneath the rib cage, and now we do it with 3 small little incisions. So the children do fantastic with it, and the repair rates are fantastic. I mean, they're certainly comparable, if not better, I think, in certain hands than the traditional open or even the laparoscopic approaches.
And Dr. Corbett, you're dealing with parents, worried, scared parents. What do you tell them when you say, you know, we're going to use robotic surgery, and how do you calm their fears?
Well, I mean, I think that's not significantly different, irrespective of the type of procedure that's being performed. Again, the robotic approach is a minimally invasive approach, just like the laparoscopic approach is, but the goals of the operation are the same, irrespective of how we're approaching it, whether it's minimally invasive or if it's an open procedure, a traditional open procedure. So in talking to the parents, number one, I always try to put myself in their shoes, you know, and relate it to my own children, and certainly if they needed this type of procedure, would I have it done on them? And, you know, obviously I think not every child needs an operation, and we're not going to push it if it's not necessary. But in those children that are candidates, I think it's reassuring to the parents to know that if it was my child, I would use the same technology. Again, we have the capability here at UVA to do it minimally invasive, whether that's robotically or pure laparoscopically or open. But again, I think the benefits of the robot are starting to prove themselves. And again, if it was my child, I would operate on them robotically, or have it done robotically, I shouldn't say. Personally, I think it's a little hard to operate on your own children, but I think that helps relieve some of the fears or tensions they have, to know that we're doing the same operation irrespective of the approach, but the robot certainly offers a nice approach for them with the same outcomes as the other approaches.
Dr. Corbett, in just the last minute, why should families come to UVA Children's Hospital for their pediatric urologic care?
Well, I mean, I think we're fortunate here because we have some of the greatest specialists, certainly in the state, and we're the only institution in the state that offers robotic surgery for pediatric urologic conditions. And so the expertise that we've been able to develop here, I think, is a very nice option for families that want to pursue a minimally invasive approach for management of disease conditions within their children.
Well, thank you so very much. You're listening to UVA Health Systems Radio. For more information, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening.